So let's talk about breast lifts and breast reductions. They're kind of similar, but there's some differences. So for a breast lift, it might be for a breast that's kind of saggy or has ptosis, or maybe the nipples in a lower position. And so the benefit of a breast lift is to tighten that skin and to raise the position of the nipple. So a good candidate for a breast lift would be someone who's had children or breastfed, someone who's lost some weight, or someone who, just as we age, those tissues tend to kind of loosen up and lose its elasticity. So a good candidate for a breast reduction is someone who has larger breasts, and they might have symptoms of headaches or neck pain, upper back pain. And so by actually removing breast tissue and making the breast smaller, that helps to improve those symptoms. So in a breast lift or breast reduction, there's different incisions that we use. The most common would be a vertical incision or a lollipop. That's around the areola and down the front, or a wise pattern scar, also called an anchor scar. So that's a lollipop around the areola, down the front, but also has a scar in the crease, kind of looks like an anchor pattern. So typically I'll use the anchor pattern because often as we age, we have more kind of skin, redundant skin in that lower pole. So if you don't remove that, you're not really truly repositioning things the way it needs to be done. And sometimes you have some hangy skin that kind of stays there. In a breast lift, we make those incisions and we don't really take out a bunch of tissue. It's more just kind of tightening skin. So you don't really go down by a cup size. You're usually about the same cup size with a breast lift. In a breast reduction, we make those incisions and we actually remove that breast tissue, so you're going down in cup sizes. If you have more questions, write them down. We'd be happy to answer them for you at your consultation. The surgery we do in an accredited surgery center. You have an anesthesia provider, and it takes about 3 to 4.5 hours depending on the procedure. So let's talk recovery after a breast lift or a breast reduction. Typically, patients don't have a lot of pain. They might have a little soreness around the incisions, but because this is just kind of skin and breast tissue and fat, we're not doing anything to the muscle, there really isn't a large amount of pain. So patients do really well. Typically, I want you to wear a bra 24/7 after surgery for the first 6 weeks, and then we'll start doing some silicone gel to really help those scars. Patients can return to work in about a week and still have some restrictions for the first 6 weeks. No strenuous exercise or heavy lifting because we want everything to heal really well. There are risks of a breast lift or a breast reduction: bleeding, infection, scars. I try to stitch the incisions as well as possible, but often the scars are kind of dependent on your genetics or how your skin heals. There's potential risk of change in nipple sensation or even healing problems with the nipple. But these are low, but can happen. So a breast lift is a great procedure for someone who has some sagging or ptosis of the breast. And a breast reduction is a great procedure for someone who has large, heavy breasts and symptoms of heavy breasts. So we look forward to seeing you at your consultation. If you have questions, write them down and bring them to your visit. Look forward to seeing you.